Coming up next, we'll be talking about the Blue Zones Project in Oregon and how a group of people are working to make communities around the country healthier. It's all coming up next on this episode of Better Life Today. Welcome to this episode of Better Life Today. Today I'm joined by Jess Hand with the Blue Zone Project. Welcome.
Thanks for having me. It's nice to be here again.
It's a pleasure to have you. We've been able to enjoy several episodes. I think this is episode number 10.
I believe so. Yeah, it's been nice to share the stories of Blue Zones Project so far, and there's been a lot to tell.
I can imagine. It's in all of our best interests to be healthy, so it's exciting to hear the different ways that not just our communities, but our entire state and country are looking for ways to be healthy. Today, we're going to be talking about Oregon. It's a project called Oregon Healthiest State.
Yeah, exactly. So Oregon Healthiest State Initiative is the initiative that brought Blue Zones Project to Oregon. So it was founded in 2013 as an initiative of the governor, business leaders, the healthcare community, looking at, hey, as a state, Oregon is beautiful and amazing, but we still kind of struggle a little bit with some of our health outcomes. We're right in the middle of the pack, and we feel we can do better. So how do we transform healthcare in a way that will really improve well-being across the whole state for all Oregonians by year 2020? And so that's really what kick-started the initiative. The initiative looked into ways that they could scale up community health across the state in a very impactful way that's upstream from healthcare. And that's where the opportunity for Blue Zones Project was explored. They saw some other states that were doing it across the country, including Iowa. The governor there brought Blue Zones Project in across 15 different communities to change health, and saw some extraordinary results over a few years. And that's what inspired Oregon Healthiest State to do the same.
Okay, and how many in that state, how many communities?
In Iowa, there was 15, but now across the U.S., Blue Zones Project is in 50 communities.
Okay,
we just
50
added
communities.
number 50, yeah.
Okay, and how many communities are there in Oregon?
So there's 4. The very first one was Klamath Falls. That was the pilot that launched in 2015. And they saw some exceptional changes in their community in the first 3 years. Smoking rates dropped, high school graduation rates actually went up, pride increased. And because of those successes in Klamath Falls, the Oregon Healthiest State Initiative wanted to put the opportunity out to more communities, so it was truly scalable across the state. So they added Roseburg, or we call it the Umpqua Valley, the Umpqua region, Grants Pass, and the Dalles. And those are the 4 communities right now that are working on Blue Zones Project being a demonstration.
So we have 4 communities here, and what you're telling me is that this doesn't just impact health as far as food and whatnot. This is impacting the whole life. You talked about test scores. So it's pretty far-reaching what you are trying to do here.
Yeah, absolutely. So I think something that was really important to the initiative was what is a good community-wide population health program that actually measures pretty rigidly well-being outcomes. And so that was something they thought Blue Zones Project brought to the table, is they measure well-being not just with physical health, which is our nutrition and our activity, which is really important, of course, but they also measure lighter things, but also very important for our health, like your sense of purpose. How can you measure that in a community? People that feel they have a sense of belonging, a sense of family, that they have financial well-being, they have social connectedness, and they felt all of these pieces together, these 5 dimensions, were really important to measure. And so that is kind of the whole root of what Blue Zones Project looks at and how we work in the communities is in those 5 dimensions.
Okay, very good. Yeah. And I'm interested in it. I grew up hearing about Blue Zones. Being a Seventh-day Adventist, we always heard about Loma Linda, and my understanding is you spent some time in Loma Linda as well.
I did. Yeah, I had the opportunity to go there for graduate school. I did a master's of public health, which I loved, and was able to work in the community there for a little while through the medical center as a community health outreach program coordinators. So we did some programs for youth after school, teaching them how to garden, teaching them how to play soccer, tutoring math and English. So it was fun to see, just kind of from roots as a Seventh-day Adventist and being in Loma Linda, a blue zone, how that translated into communities that wanted to adopt these lifestyle principles that we see as Adventists, in our day-to-day life.
Right.
Yeah.
And now you're coming home. You said you live in Roseburg now.
Right.
And
yeah.
we were talking earlier, and we have something in common. We both attended Milo Academy.
Right, exactly. So it was a dream for me to be able to move back to the Northwest and back to this beautiful area of Southern Oregon a few years ago. I was doing some worksite wellness programs at the time, but when I heard that Blue Zones Project was coming to Oregon, I knew I had to apply for this position. It sounded like a dream job for me, just with a background in public health and worksite wellness, because it really merges the two together. It's not just programs working in silos, but it's a community coming together to work on schools and work sites and policy as a community all at the very same time. So in Oregon, we know we have our work cut out for us, being in the middle of the pack. Also in Southern Oregon, the counties here are really struggling a lot from childhood obesity, children living in poverty, homelessness. I know for us in Roseburg, graduation rates are really a concern. So is unemployment too. So these are some of the issues we look at the same time.
Okay.
Yeah.
And how long has Blue Zone been active in Oregon?
So it launched in Klamath Falls in 2015, so going on 4 years now. And then the newer communities like Grants Pass, Roseburg, and the Dells just launched 2 years ago. So we're about like a year and a half into the work, pretty early on still.
Are you seeing results at this point?
We are. So for us, well, let me share about Klamath Falls first.
Okay.
Like I mentioned, their graduation rates went up after 3 years. They measured community pride, that also increased. Smoking rates dropped. They were also awarded a really prestigious award through the Robert Wood Johnson Foundation.
Okay.
Which really looks nationally at best practices for what communities are doing really well with health and well-being. And they were one of 4 communities to actually receive that recognition. So that was exciting for them to get those accolades. For us, just being a little bit newer into the project, just like I mentioned, year 2, we're already measuring how health behaviors are changing within organizations that we work with. So we work with schools, work sites, churches, restaurants, grocery stores. We also work very closely with individuals one-on-one, just in their personal lives through cooking classes, purpose workshops. But within those organizations that we spend a lot of time, we're already seeing that the schools that have been working with us are now reaching that 150 minutes of physical activity a week as a benchmark. When we first started out, that was a real challenge. In our community, there was a lack of resources with physical education teachers, and so we've been able to supplement that with some activities that teachers are doing in the classroom with the kids that doesn't necessarily need to be done in PE. We're also teaching kids how to get out and walk and ride on bikes safely in their neighborhoods and around the school, so they can walk to school together and walking school buses before the beginning of their school day, and then afterwards. That also helps them get more natural movement in and really helps to improve behaviors during the school day as well as.
So you're actually going into the schools and helping instruct them. Are you providing other resources to the schools as well? Or?
Yeah, so the neat thing is they actually get to choose a menu of best practices that they'd like to work on. So it could be anything from physical activity to nutrition in the cafeteria. For us, we also work on teaching kids with discipline issues, ways to kind of work through some of those challenges, especially if they come from homes where trauma might have been present, or they may not have had role models or parent figures in their life. So kind of how to work through and overcome some of those challenges. So that's been really exciting for us to see that unfold in the classroom too.
Sure.
Yeah. We're also seeing in our community, there's 6,000 residents that have already participated in the project, whether, like I mentioned, coming to a cooking class, a purpose workshop, joining a social group that we call a MOI, which is a social group that gets together for 10 weeks around a healthy habit, like walking, trying plant-based recipes in potluck form, or exploring their purpose in more depth too. And so that's been really popular. We're also seeing an increase in the amount of funding that's being spent on infrastructure that makes it safe to walk and bike in our community. So we've been able to see some grants come in through our efforts that help to build sidewalks, bike lanes, safe crossings in front of schools. So it's really easier for kids and families to get there on foot.
So are you coordinating with government agencies then and helping develop this, or are they seeing the need for it based on the improvements?
I think
that
it's
they're
been
seeing?
both. Yeah,
Okay.
at the front end of the project, it's really important that you have local government support, because one of the pillars of Blue Zones project is policy. For things to truly be long lasting and generational in a community, you need policy to pass that's supportive
Right.
of the healthy choice being the default. And so they were at the table at the beginning, but I think as they've seen the desire from the community to have more of these options available, they've been excited to invest in it more and more themselves. Yeah.
Well, very good. So what would you call then the keys to success for a Blue Zone community?
There's a couple of things that we've noticed across all Blue Zones project communities, not just here in Oregon, but the US, that we think are really important and help the project to take off and get roots and really have a community rally around it. And I think it goes back to just what you mentioned, strong leadership, like a community that comes to the table, that wants to work together and not necessarily do programs that are just in silos. So for us, it's been exciting to see people that have been doing really similar work or wanting to solve similar problems in the community that had never met before. And now they're sitting around the same table talking about how can we do this together. And so Blue Zones Project has helped to accelerate progress towards some of those issues we're looking to address. We also would say, I think it's giving a community a name and a vision for the change that they want to see. So giving it a banner of, we're all doing this together. It's called Blue Zones Project. It's in our schools, it's in our workplace, it's in our retail establishments and food industry, but it's something that we all want to see together for the betterment of our community's health. And that's been a really inspiring rally point for us. Yeah.
Well, we're really excited to be hearing about this. We're going to take a quick break, and we'll be right back with Jess Hand with the Blue Zone Project just after this. Thank you.
Better Life Broadcasting is a viewer-supported Christian media ministry that offers streaming programming via apps on various devices. Please visit blbn.org to support Better Life or to get more information. And don't forget to like and subscribe.
Welcome back to Better Life Today. We've been visiting with Jess Hand with the Blue Zone Project and just enjoying learning a little bit more about what you're doing and about how you said there were 50 communities across the country. Is that correct?
Yeah.
And how many are here in Oregon?
So we have 4 here in Oregon, which Grants Pass is one, as well as Roseburg, the Dalles, and Klamath Falls.
Okay, so obviously there are some needs here in this state, which surprised me a little bit, frankly. I come from the Portland, Vancouver area.
Yeah.
And we have bike lanes everywhere. You see the greenery. It surprises me a little bit that we have some of these challenges, but it just kind of communicates that there are needs everywhere.
That's right. And I think with Oregon, something that we especially struggle with that people don't necessarily think of is health disparities. So you have Portland, which has a lot of great opportunity for health and well-being built into the infrastructure there. But we have other counties, especially here in Southern Oregon, that really struggle with access to some of those things that, you know, we might think are amenities in other areas.
Okay.
So.
And you know, some of us may be wondering why we're Better Life Television. Why are we talking about Blue Zone projects? And you know, there's a few reasons. We're Seventh-day Adventists, and health is very important to us. In fact, on Better Life Television, we have a channel devoted to health. We have a Blue Zone project that is specific to Loma Linda.
Yeah, Blue Zone, Loma Linda was one of the original Blue Zones studied, yeah.
Yeah, and so what we're trying to do here is we want to talk about the health message, and you guys are doing amazing work in our communities, bringing that to the forefront. So I'm really appreciative of what you are doing in our communities.
Well, thank you. I know for me, it's been really inspiring growing up Seventh-day Adventist, going to Loma Linda, living there, and then living in another community that actually brought the project and was trying to emulate some of these lifestyle principles that were studied in the original Blue Zones. So Loma Linda is a great example of just lifestyle that's part of a community, like a routine for us, just a part of our day-to-day life. And there's 4 other Blue Zones too that were studied that had a lot in common actually with Seventh-day Adventists. So.
Well, very good.
Yeah.
So we've talked about the keys to success. So what was it about our state, the state of Oregon, that made it such a good fit?
Yeah, well, I think with Oregon, knowing that we were in the middle of the pack, looking at well-being, and we measure that across the country through Gallup with the well-being index, and Oregon ranks right around 28 or 29 out of 50 states. And so they were looking for ways to, how do we actually transform the landscape of healthcare so it's more upstream and preventive, and it actually brings a community together to change some of the things that we really know impact our healthcare outside of the hospital.
Right.
Employment, education, housing, being able to feel like you belong in your community, you're proud of it, you feel safe and secure, you have a strong purpose for yourself. These are some of the other aspects of well-being that are extremely important and maybe not as, they're not talked about as much as the other aspects like physical health, nutrition, and exercise. So that's why Oregon Healthiest State felt that it was a good fit to bring Blue Zones Project here. I know in our community, we not only demonstrated that we had a strong need. For us, smoking rates are very high compared to the state, so is childhood obesity, but we had a strong readiness. Our local leadership came together to say, we want to do something that's different, that inspires hope and healing in our community, and we want to do this together. So that's why it was a good fit for our area.
So what I'm hearing, this wasn't Blue Zone going out and looking, this was actually the communities reaching out to Blue Zone as an opportunity to enrich their community. Is that correct?
In a way, yes, because Oregon Healthiest State brought it, in. It's like, this is our strategy statewide, and then put the opportunity out to communities to apply for it. So we had to go through an application process, just like Grants Pass and the other areas. We had to do a site visit where they came and visited and looked at our health statistics, met with our leadership, our local healthcare community, our schools, and assessed the need, and really wanted to hear, like, how are you going to make sure this transforms your area in the next 3 years? And so for us, we were able to move through that process and be selected, which we feel very grateful to have that opportunity for. The project receives funding from Cambia Foundation that made this possible in the state and the 4 communities it's in.
Okay.
Yeah.
And that level of commitment, I would think, really is what, you bring all these resources together, and that level of commitment keeps it going. So what does it look like as you're moving forward? How do you keep assessing what's going on and where you're needing more help and where your successes are?
Yeah, that's a great question. So it's a pretty extensive process. When we start out in a community, we gather a lot of input, looking at the health data that's already available, looking at the plans that the community has already come up with, whether it's through healthcare or the local government area within schools, but really bringing all of that together to make a blueprint for a community that's very customized and tailored to the community's needs for 3 years. And each year we go back and we look at how did we do? Did we move the needle? How are we doing within each of these organizations we're working with? How are we doing at a community level? Is food insecurity going down? Is obesity going down? So we measure that pretty rigidly each year. We're in the process of doing a big survey again. We actually just wrapped it up, where we'll be using the well-being index to see if we actually moved the needle since the very first year in financial, social, purpose, community, and physical health. Those are the 5 dimensions we measure. So we'll be very interested to see how those numbers look this year. Yeah.
Very good. Can you share with me some examples of how communities are implementing and using the Blue Zone Project?
Yeah, absolutely. So for us, our framework is really 3 pillars: people, places, and policy. And we know when there are changes in each of those pillars, it really creates a tipping point in a community for the health to improve. So for us, when we talk about people, what that means is we're engaging our community in well-being opportunities every single day, whether it's them coming to a cooking class, joining a social group called a Moai, exploring their purpose. We've had in our community 6,000 people that have plugged into one of those activities and made a pledge for their personal health. For places, there's so much to talk about here. I think before the break, I shared a little bit of what we're doing in schools, what we're seeing in some of the policy areas that are related to that. But it's been exciting to see what work sites are doing that have worked with the project. So they're offering more benefits or environmental changes that actually prompt employees to move more during the workday. So whether that's making sure they have time to go out with a walking group during a break and making sure that's something that's encouraged and supported by leadership, or actually creating walking routes and maps around their campus, it's really taken off as far as it being a priority for them to provide that to their employees. They've also, for us, it's been exciting to see churches too. Like here in Grants Pass, the churches have been really involved with leading these walking school buses with kids. So helping the kids get from their neighborhood to the school each morning and afternoon on foot. So
Really?
they all walk together, they pick up kids along the route. It's a great way for kids to get that physical activity again, but with safe, chaperones or guardians there with them. So that's really neat to see. More churches are exploring how they can do healthy potlucks after service, so trying out different recipes that are a little bit healthier and focus on fruits and vegetables. And also for us, it's been really exciting to see how it's impacted our restaurants and grocery stores. We work with them to promote healthier options and make that at the forefront of the menu or as you walk into the store. And for them, they're seeing an increase in sales. Like our local grocery store has exceeded all of our expectations for the amount of produce that they're now selling just by putting it into the checkout lanes. So usually there's like a...
So instead of the junk food at the checkout
Exactly,
lane, you're starting
yeah.
to see healthy options.
That's right. So they have several lanes where they swapped it out. And so now there's nuts and fruit and bottled water, things that they can grab and go with their family that's just a little bit healthier.
So how is something like that coming about? Is that because they're seeing it in the community, or are you guys engaging with grocery stores and restaurants as well?
Yeah, so that's the neat thing is we actually go out to them and provide these ideas. They give a menu of best practices that they can choose from. We help them implement it. At the beginning, it was a lot of us going out and doing the outreach and
Right.
asking if they wanted to join in. It was pretty new to the community, like, what is this?
Yeah.
But now that they're seeing it pop up all over town, we're actually getting the requests coming to us.
So they're
How can we
starting to buy in, because I would
Yeah.
assume there would be some initial resistance, because
Yeah.
this is the way we've been doing it forever.
Right.
We
Yeah.
have mom and dad with their kids grabbing the candy and
Yeah.
everything else, and now they're seeing some different opportunities.
That's right. They're seeing that there's actually a demand there for healthier options. One restaurant owner told us that he used to throw away produce every week because it just wasn't selling off the menu. Now he's tripled his order or doubled his order each week, and he's throwing nothing away because that demand and that awareness is really coming from his customers at this point.
So this
Yeah.
is affecting the entire community then, and you have these groups that are signing up. You said 6,000 people in your community
Yes,
had
yeah.
signed up, but it probably, as people are getting healthier, you're seeing, my goodness, you're seeing a walking school bus. How cool is that? You're going to be curious what on earth is going on.
It's all about changing the culture of health, and that's really what Oregon Healthiest State wanted to do, is how do you change a community's culture? And when you see it all over every day in your town, when you go to your workplace, you drop your kids off at school, you can't help but be inspired that it's kind of the new norm.
Yeah.
Yeah, and that's what's happening in our community and across Oregon.
Well, very good. I'm so excited about what we're doing in our communities. We're all involved in this. We all want to be healthier. We want to raise our kids in a healthy environment. We want to go shopping where there are healthy options. And I'm excited that we have projects like yours that are helping us do that. Is there anything else you wanted to share with us about what your project is doing right now?
Well, I think for us, we're wrapping up year 2. year 3 is right around the corner, and we're talking already about what phase 2 is going to look like. The community wants to keep this going, and so it's neat that we'll be able to continue to tailor it to meet the needs that are the most relevant and present right now for our area and across the state too. So I think we're really excited to see what's next.
And so you've been here in Roseburg for 2 years, Grants Pass for 2 years?
Yeah, that's right.
And what was the original length of the program going to be?
So just 3 years. So
Okay.
it's based off of a 3-year model to begin with, but many of the communities across the U.S. transition into another phase to keep
And
it
are
going.
other communities looking at this and applying as well? Is it expanding that way?
Every day, yeah. So it's been neat to see the interest in it. You know, Blue Zones Project nationally, you know, goes out and visits the communities that want to apply to do something like this themselves, and kind of vets them through a similar process that we had to go through. Is there need? Is there leadership and a desired readiness to bring something like this in? Because it takes those keys to success to really get it off the ground.
Right.
So.
Well, I would guess that some of our viewers have some interest in learning some more about you. Maybe are there opportunities to volunteer?
Absolutely. A good way to plug in is going to either Blue Zones Project's website. You can just Google Blue Zones Project Oregon to find us, and there'll be some contact information that you can find on that website. Or you could even go to Oregon Healthy Estates website too, which talks about all of their initiatives across the state of Oregon. Both of those are great resources to get involved.
Okay, very good. Well, Jess, it has just been an absolute pleasure to meet you and to get to talk about this. It's so important. I have 3 children of my own, and we want to raise our kids in communities that are healthy.
Yes.
So I want to thank each of you for joining us today. There's so much we can learn from each other, and get involved. If you see, you said we have these walking school buses. That's intriguing to me. So look for what's going on in your community, and if you don't see anything, ask, talk to your leadership,
Yeah,
get the
start
get the
it.
ball rolling and
Yeah.
start it.
Yeah.
Find out ways to get active and be involved. Thank you for watching Better Life Television today. I really enjoyed this opportunity we have to engage with our community.
Thanks for having me.
Thank you.
Yeah.